Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Yeah, so hypertension is a very common problem in the Indian subpopulation, and it is largely underdiagnosed because it usually does not give any symptoms to the patient. So patients are either roaming around undiagnosed, or they tend to find out about their hypertension only on a routine annual checkup. But it is important that we get ourselves annually checked so that we don't miss out on this problem, because it can have long-term clinical outcomes which can be harmful for the patient in the form of heart attacks, strokes, kidney dysfunction, problem with the vision, etc. So it is important to hit early and hit hard on hypertension so that we are safe from all these problems.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
If you have a strong family of hypertension, it should be clear in your mind that you are always at a risk of developing hypertension in the future. So, monitoring your lifestyle and ensuring or checking what you eat and ensuring a good physical activity is very imperative to at least delay the onset of hypertension in you. And the later the onset of hypertension, the lower are the chances that you will develop the long-term harmful diseases due to hypertension. So hypertension is a multifactorial disease, and the most common risk factors for it are genetics as well as lifestyle changes. And people who have a family history of hypertension in their parents or in their first degree relatives, they have a higher chances of developing hypertension either at present or in the future. And genetics, apart from genetics, the lifestyle of the patient, that is eating a lot of junk food, having a high salt diet, not doing enough physical activity, these also contribute to earlier development of hypertension in patients.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
So it is a common misconception that the BP should be 120/80, and anything higher than that is hypertension and anything lower that is hypotension. But actually there is always a range in medical science, and a BP less than 130 systolic, that is the upper value, and less than 80 diastolic, that is the lower value, is considered normal. And patients who have a BP higher than this are then categorized according to the guidelines into pre-hypertension, stage 1 hypertension, stage 2 hypertension. So the cutoff value that is followed is generally 130/80, or that is for the cutoff for the pre-hypertension. And to diagnose a clear-cut case of hypertension, we take the cutoff as 140 and 90.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
When the patient is first time diagnosed with hypertension, the most important and the most beneficial long-term effects are of lifestyle changes. So the patient should cut down on their salt intake. They should do regular physical activity in the form of rigorous or high intensity exercise for at least 30 minutes for at least 5 days a week. They should cut down on their alcohol and smoking, and they should always try to lose weight if they are lying in the overweight or obese category.
Can we say that hypertension can be treated without medication?
Hypertension, if it is in the pre-hypertension stage, that is the early stages, not a clear-cut diagnosed case of hypertension, like I said in the earlier question of stage 1, stage 2 hypertension, it can be managed medically without the help of medications with the lifestyle changes that I had just mentioned. But if the patient shifts or his BP increases to the stage 1 hypertension stage, it rarely comes down without medications, and generally we need to resort to medical help.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
First of all, we need to make things clear that hypertension is not curable. It can only be controlled with medications. So the patients who are started on medications, after confirming that they are candidates for medications and they need medications, the medications are generally continued lifelong, with possible increases in the dose of medication with increasing age. And sometimes patients need to titrate up their doses during winter months, which can then again be down titrated during the summer months. So generally the patients require medication lifelong, but that does not mean that the patient stops doing the lifestyle modifications, because they also help in improving the blood pressure of the patient and have many more beneficial effects than medication alone in the long run.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
So checking the blood pressure at home is very important, and it is recommended by all the guidelines. And when we are starting the treatment for hypertension, then the patient should check their BP regularly on a daily basis, and preferably 2 readings at least, one in the morning and one in the evening. And there's a proper technique to take a blood pressure at home. The patient should take the BP after sitting comfortably in a quiet environment for at least 10 to 15 minutes. They should not be holding their urine. They should not have eaten anything immediately prior to it, and they should check their BP once. And if the BP reading is higher, then they should wait for 10-15 minutes and check the BP again and note down the second value before confirming that the BP is raised. And once the medications have been titrated and we have decided, yes, this is the perfect dose for the patient and we don't need to increase or decrease the dose of the medication, then the patient can check the BP at least 2 to 3 times a week.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.